Thank you all for having us. I would just like to talk very briefly about why healthcare is important to young Americans and specifically to young Montanans. A young lady I know, a recent graduate, just enrolled in an extra semester of college because the health insurance market won't cover, at any price, her heart condition. Health insurance companies refer to her heart problem as a pre-existing condition. Before graduating, she was covered by the university's healthcare, but since then she has been unable to find another provider. Paying tuition this semester, plus the student health insurance fee, is the only way she can cover her necessary medical expenses. But many of us don't have the resources to pay for an extra semester to be cured. For even healthy graduates, healthcare costs can be quite daunting. A co-worker of mine saw his health insurance fee increase from close to $250 a month to $350 a month in a year that he never saw a single healthcare provider. Nearly 2 out of 5 college graduates and 1/2 of high school graduates who do not enroll in college will be uninsured for a time during the first year after graduation. Almost 20% of those uninsured in America today are between the ages of 19 and 29. As a member of the student government at the University of Montana, I met a young man from Nevada named Jake. Jake and I share a lot in common, and we've become close friends. Jake grew up riding horses on a ranch in the great American West. Before attending the University of Montana, Jake went to school in Utah. His freshman year, and subsequently he took a semester off to work. During that period, his kidney failed. Unfortunately, he was without medical insurance. The ensuing medical bills totaled close to $19,000 today. As a transfer student at the University of Montana, Jake was engaged in his community. He was an elected member of our student body and a volunteer for numerous organizations in the Missoula area. During the summer months, Jake worked as a firefighter in Montana to pay for his education. While defending our homes and natural resources, he managed to graduate on his own without significant college loans. Unfortunately, he is being sued by collection agencies for medical bills. Jake's future was declared bankrupt before it began. America's healthcare system deprives many youth of stability and safety, and in some cases, America's healthcare system has deprived us of our future. We're not talking about handouts or hand-ups. We are describing a system that works against young Americans, most poignantly, young Americans who are willing and want to work for America. My generation knows that we can do better. As a young student in the East Helena and Helena public school system, American ingenuity was impressed upon me as one of the definitive values of our country. We have the solutions and the ideas here in America to fix our broken healthcare system. What we have lacked is the political will. Just as Jake's story is the story of many young Americans, my optimism is shared by my peers. Over 2/3 of my generation know that the U.S. can provide health care for all Americans, and we are working to make that future now. The movement to reform health care has accumulated over 250 volunteer hours from young Montanans in the last month alone. We are asserting our presence in the policy decisions that affect our future, and health care is immediately on the agenda. America's healthcare system has failed us, and we have failed each other if we cannot capitalize on our assets to make the current system a system that works for every American. We believe that just as generations past have overcome difficulty, we can move forward and solve this problem